This is an audit of the Cork University Hospital Post-Anaesthesia Care Unit handover. Starting with introduction and methods, effective handover of a patient's care in the recovery room is essential for the continuity, quality, and safety of patient's care. The Association of Anaesthetists guidelines state that the anaesthetist must formally hand over care of a patient to a recovery nurse or other appropriately trained member of staff. Much of this is an informal process. Handover between nurses has been extensively analysed. While the introduction of shift working patterns, there has been some work on handover between doctors. There's very little published on handover between different professions. Systems exist for standardized transfer of information between healthcare professionals. The aim of this audit was to determine if the handover in Cork University Hospital PACU met the standards set out in the Association of Anaesthetists guidelines. Our self-defined best practice target was for 100% of handovers to reach the standards set out. The standards were selected in line with the recommendations from the Royal College of Anaesthetists. Data was collected using a predetermined data collection sheet after a patient had been handed over to the PACU nurses. This retrospective audit was carried out in July 2025 in Cork University Hospital. A total of 26 charts were reviewed over 10 days, including both emergency and elective cases. None of the handovers reviewed in this audit met the self-designated best practice standard of 100% of standards met, as seen in Figure 2. The closest standards to meeting this target of 100% were anaesthetic type at 96, patient details at 92, operation at 88, and medical history at 88% also. The worst standard to be met was the documentation of a post-operative recovery plan with only 58% of handovers including this information. Interestingly, when the data is analysed by consultant against CHD handovers, there is a clear disparity in two standards. The first is perioperative complications. Only 50% of consultants mentioned any perioperative complications, as compared to 94% of NCHDs. The other standard where these two groups differ is documentation of the post-operative anaesthesia plan. 70% of consultants document their plan, while only 25% of NCHDs do. So for the summary and conclusion, PACU handovers at CUH don't yet meet best practice standards. Key info like patient details is usually passed on, but crucial elements like the post-op plan are often missed. Differences between consultants and NCHDs highlight a need for a unified training. Structured education and a standardized handover process are vital. A re-audit after these steps will ensure safer, more consistent patient care.